welcome the Honorary Member of Parliament for Chennai South, Dr. Nilesh. As we've all heard, she is a noted Tamil poet, lyricist, orator, politician, and a writer. She is a strong advocate for women empowerment and has been noted for her work on upliftment of women and the rural and the poor. This event may not have been would not have found a better pattern than herself. So, ma'am, we extend a warm welcome to you. Dr. Gopinath, who has joined us recently in Kauvery as Director for Reproductive Medicine, is an achiever in his field. He's worked and collaborated with many institutions in India, Australia, Germany, France, and Israel. Dr. Gopinath has been a teacher and a guide to many IVF specialists in the city. He has been the Chairman Board of Studies of Tamil Nadu Dr. MGR University for over 27 years. And he is keen on fertility preservation for young cancer patients. That's possibly special work that we can speak about. So we extend a warm welcome to you. Dr. Chandrakumar, we all fondly call him Dr. CK, an anesthetist from Trichy who dared to dream big and create an organization that today has established itself in 2 states, in 6 different locations, with 12 hospitals and still counting. We are really fortunate, sir, to have you by our side, guiding us all the way in our pursuit to create affordable and accessible healthcare. So we welcome you. There are many of my colleagues who joined here to grace this occasion. To all my fellow colleagues, I extend a warm welcome. To my doctors and to my other support staff, the members of the press, the media, and everyone. Without further delay, let me hand over the baton to the next Dr. Gopinath, and I thank you all and welcome, extra warm welcome to all of you.
Thank you, sir. And now I call upon Dr. P.M. Gopinath to please come forward and share a few words. May please give a big round of applause, ladies and gentlemen.
Respected dignitaries on the dais and off the dais, thank you very much for inviting me to be a part of this celebration. Just to give an overview, a man and a woman, when they try to conceive, to have a baby, they take about 5.1 months. So that means in 1 month, they have the chances of having a baby is 20% or 0.2 probability. So over a period of about 6 months, 50% of them conceive. At about the end of the year, you will see around 80% that would have conceived. So that is the reason we wait till about 1 year, and then in case if they don't conceive, then we start in doing all the tests there. So it can be a man, 1/3 of the problems will be with the man, 1/3 it will be only a woman, another 1/3 it will be both man and woman together. For example, there will be a tubal block, there will be a low count, both put together in that couple. So that is the last 1/3. So at a given time, you have more than 50%. The man is responsible, female is responsible. So if you take the man, normally what we call this as a sperm test, semen analysis is a simple test. At the end of it, we can have no count, where he is not able to have any count, or it could be low count, or it could be a normal count. If it is a normal count, we focus on the female side and investigate. If it is on the low count, we use some methods of medical management to improve the count so that they can have a normal conception. And if there is no count, we have to find out whether it is being produced in the testis and not being transported, or it is not at all being produced in the testis. Today, we have excellent tests to find out what is the issue, and based on that, we have technologies which I just at the end of the talk I'll tell you. So we have technologies with which almost all men can have a baby with or without sperm in the ejaculates there. Coming to the female part, if the fallopian tube, like a tusk of an elephant, picks up the egg and then gets fertilization done in the fallopian tube, and the fertilized embryo is transferred back into the uterus to continue as a baby. So this is not merely an open tube, it should be physiological, it should be functional tube. So look at the tube, it can be blocked. If there is a tubal block, we do some surgery and try to remove it, repair the block, or we send them for IVF. And if there is an ovulation, normally the woman will have a regular menstrual cycles once in 28 days, and that shows probably she is ovulating. When she has irregular menstrual cycles, probably it denotes there is no ovulation. There are special simple blood tests with which we can find out whether she is ovulating or not ovulating. What is the cause for her not ovulating? So we use ovulation inducing drugs and then we can correct it. And then there may be some problem in the uterus in the form of a fibroid, abnormalities, which will be addressed by surgery, and then we can make it all right. With all this factored together, what do we have in the treatment paraphernalia? The first point is we ask them to have a normal contact at a more suitable time to have a baby. The second is we give them ovulation inducing drugs. We do a monitoring and ask them to have a conventional, the fertility period, normal contact to have a baby. Third point, probably what we do it as an IUI, which we have seen it in the theatre now, in the IVF center. We ask the man to collect the sample. We prepare a solution where the best motile sperms are suspended in a culture medium that will be directly injected into the uterine cavity without anesthesia as an outpatient procedure. Patient can go home within an hour. What we call it as IUI. This is a very, very popular method, but there are some criteria. One is the tubes has to be patent, she should be ovulating or made to ovulate, and the count has to be normal at least between 5 million and 10 million. If it is 1 million and less, we cannot do an IUI. So when you do one IUI, you have chances of conception is roughly about 20%. If you do two, probably 25%. If it is more than 3, it comes down to 11. So we say do 3 IUI, failing with send them for IVF. What is IVF? We instead of normally the woman ovulates only 1 egg. When we try to do an IUI, we make her ovulate 3 eggs. So when we do an IVF, we give enough hormones to make sure she produces about 15 eggs. We take her to the theatre under anesthesia, aspirate the entire eggs, and then make it in a petri dish, and then put it along with the sperms, and then see whether they could conceive. This is called IVF. So another method, advanced method on this is ICSI, where you take 1 egg and 1 sperm, directly inject it inside, and make sure the fertilization takes place. We have technologies here available in the same place where we can do IVF, we can do IUI, we can do ICSI. Then after that, there are several newer methods have come where we can take 1 cell out of the embryo, test it to find out whether it is normal or abnormal, and then re-implant it. What we call it as a pre-implantation genetic diagnosis by using a special techniques there. For that, we need a laser, and with that laser, we can just take 1 cell out of the embryo and test it. That facility is again available in the group of Kauvery hospitals. And then we have, after the advancement, when you come to think of preserving the fertility for the woman, it can be done for gynecological problems, non-gynecological problems. For example, the patient has got some disease for which she is going to be put on some drugs which is going to decrease her fertility potential. So those before the treatment, we can take out the eggs and then preserve them. So this is called fertility preservation. We have the technology available here. And for example, a patient whose parents or the sisters have stopped menstruation by about 30-31 years, what we call it as a premature menopause. So in those women, we can always catch them at around 24, take out all the eggs and keep it, so that we can fertilize it later and put it back. So this is one indication where we can very easily do it here. The last is on the cancer patient. Very young patients when they are subjected to cancer, their cancer treatment, radiation, chemotherapy, all of them will destroy their fertility potential. So before starting the cancer treatment, we can do the fertility preservation in them, and then there are a lot of techniques available. Almost all of them are available here in this room. So we can do that and then subject them to the cancer treatment. After the completion, they can come back, have the embryo implanted, and then they can go back and have a normal healthy baby. So these are all in nutshell what is happening today, and almost I am very, very happy that Kauvery group of hospitals have got all the facilities set up in this group. So we are very happy to serve the needy patients. Thank you very much for the patience.
Thank you, sir. Thank you very much. Dr. S. Chandrakumar, the founder and executive chairman of Kauvery Hospitals, is a qualified anesthesiologist who founded the Kauvery Hospitals with a vision to make affordable healthcare a reality in rural and urban areas. He has always placed a strong emphasis on world-class treatment and personalized care for all patients. I request Dr. Chandrakumar to please come forward and share a few words about the team at the Fertility Center. Big round of applause, all of you, please.
Thank you, Dr. Gopinath. I think it was a session what is needed for us also. When we moved into the administration, most of the scientific aspects were forgotten. But you spoke in a very simple way, where a lot of the other even staff also could understand. While you were speaking, I was thinking we should do a YouTube channel to give awareness to the public in a simple term. A lot of confusions and myths are there. It's quite informative. We will talk it up offline. I would like to thank our Chief Guest today, Madam Honorable Member of Parliament, Thaman, for sparing her time. I know this is a very hectic time with the elections nearing the country, and you gave your time. Thank you very much, ma'am. Dr. Anil, Dr. Tendral, we have the fertility consultants, Dr. Ramya, Nitya, and Rajalakshmi, and all my colleagues. So now Kauvery is in the 25th year. So last Sunday we celebrated the 25th year anniversary. It looked as if we started a few years before. We still feel young. Some of my colleagues told that we are already old. But I think we have a long way to go. So what we started with just mere for a trauma and critical care 23 years before with 30 beds. Today we have grown and we are happy, but I think we have a long way to go. But we started with the trauma and critical care. Today we have spread across all the cardiology, oncology, transplants, all the departments. But we thought as we started moving, we felt there's a need for a comprehensive mother and child care. When you say mother and child care, it is obstetrics, gynecology. In the gynecology, Dr. Tendral is here. We have endoscopic, laparoscopic gynecology, we have fertility and pediatrics gynecology. I think that we want to do as a subspecialty. The first hospital we have launched in Trichy on January 29th, 200 beds only for mother and child care. At any given point of time, we have 50 babies below 20 days. That's the amount of volume what we are trying to do there. And the next 3 years, we want to focus in all the locations, wherever we are present there, focus on the mother and child care. I think under Dr. Tendral now, it is, I think when we are doing practice in the early days, when I was in Trichy, Dr. Gopinath's name is there in the country, in the southern part of Tamil Nadu. He comes and travels all over the part. And the most difficult for the embryo transfer used to be there. I'm very, very happy. And thank you very much for being part of this. And we'll be leading the fertility at the group level. And what we have been hearing in the recent past.
Dr. Gopinath, Director, Medicine, Kauvery Hospital. Dr. Anil, Medical Director. Dr. Chandrasekhar, Chairman. And the wonderful team of Dr. Ramya, Praveen Chandra, Dr. Nitya, Dr. Rajalakshmi, and Dr. Tendral. இந்த நிகழ்ச்சியில் என்னோடு கலந்து கொண்டிருக்கின்ற புனித தோமையார்மலை ஒன்றிய செயலாளர் அன்புக்குரிய தம்பி திரு வெங்கடேசன், ஒன்றிய குழு தலைவர் சகோதரி சங்கீதா பாரதிராஜன், நண்பகலம் ஊராட்சி மன்ற தலைவர் தம்பி திரு கிரி, fellow doctors, who are a part of this wonderful inauguration, and all the medical team as well as the team of nurses, the office bearers, everyone. எல்லாருக்கும் என்னுடைய அன்பான வணக்கம். நான் படிச்சதுலே எனக்கு ரொம்ப ரொம்ப பிடித்தமான எமர்சன் அவர்களுடைய ஒரு சொற்றொடர் ஒன்று உண்டு. ஒரு ஆரோக்கியமான குழந்தையை உருவாக்குவதன் மூலமும் அழகான ஒரு சிறிய தோட்டத்தை பராமரிப்பதன் மூலமும் சமுதாயத்தில் மிகவும் பின்தங்கிய வகுப்பினருக்கு இலவசமாக கல்வி கற்பிப்பதன் மூலமும் நீங்கள் இந்த உலகத்தை முன்பு இருந்ததை விட மென்மேலும் அழகானதாக ஆக்கிவிடுகிறீர்கள். How beautifully Kauvery Hospital has made this particular place today as the most beautiful place in Chennai by inaugurating a wonderful Kauvery Center, especially for fertility, which is not actually connected only with female but also connected with male. Thank you, Dr. Gopinath, for such a enlightening introduction about this center. And before going to his remarks, I'd like to congratulate this Kauvery hospitals. As has been rightly pointed out by Dr. C.K., you're very young still, but the steps are not baby steps, I think. You have taken up a giant leap, I believe, constructing so many other departments, not merely the cardiologists and the other sections. I believe, how many floors, doctor? 12 floors. And this, another news to be congratulated is in Trichy, a full-fledged caring center for both the mother and the babies, and almost every day 20 babies are there being taken care of. ஒரு மருத்துவமனை தன்னை விரிவுபடுத்திக் கொள்வதிலும் பல்வேறு தளங்களில் ஈடுபட்டு மக்களுக்கு சேவை செய்வதும் இயல்பான ஒன்றுதான். எந்த மருத்துவமனையும் புதிதாக தொடங்கப்படும் பொழுது அடுத்த கட்ட நடவடிக்கைகளை அவ்வாறே மேற்கொள்வது சகஜம், வழமையான ஒன்றுதான். ஆனால் மிக குறிப்பாக இந்த காவேரி என்கின்ற குழந்தை இல்லாத தம்பதியருக்கு குழந்தை தருகின்ற அந்த சிகிச்சையை அது மேற்கொள்ளும் பொழுது அந்த தொடக்க விழாவிற்கு என்னை அழைத்தது என்பது எனக்கு கூடுதல் மகிழ்வு. I'm so happy to inaugurate that section being a woman, and I'm also enlightened by the facts which Dr. Gopinath has shared it here. Because there is a lot of taboo attached to it, especially women, we bear the cruel brunt of it. இருவரும் இணைந்துதான் இந்த பயணத்திலே செல்ல வேண்டும் என்பதை மிக அழகாக டாக்டர் கோபிநாத் அவர்கள் நமக்கு தெளிவாக எடுத்து சொன்னார். அந்த வகையிலே inaugurating a center, especially a fertility center, is a wonderful initiative which I would like again to congratulate this hospital for having taken up that venture. And I believe the scientific temper is the gift to mankind. நிறைய இடங்கள்ல குழந்தை பிறக்காம இருக்கிறப்போ இயற்கை மேல் கடவுள் மேல் பாரத்தை தூக்கி போட்டுவிட்டு இருக்கின்ற பெற்றோர்களை நாம் பார்த்திருக்கின்றோம். அது ஒரு வளமையான ஒரு விஷயமாக நம்முடைய சமுதாயத்தில் இருக்கிறது. But science is a boon, is a gift given to us. And how you can intervene in all those misfortunes through the science is the best example of this IVF. And in this hospital, even I was just wondering all these things. The doctor has explained so many steps. They just don't jump immediately into IVF. That is the fear most of the parents, most of the women and men, they nurture in their hearts. They're not prepared and they're not clearly explained also. So this hospital having different stages of taking up that treatment, not immediately jumping into it, and slowly taking up and trying out in each way of intervening them is again a very, very healthy attitude. பொதுவாக மருத்துவம் வியாபாரமாகிவிட்ட இருக்கின்ற இந்த சூழலிலே மருத்துவத்தை அதற்கான ஒரு ஆரோக்கியமான எத்திக்கல் வேல்யூஸ், அதற்கு உரிய அதற்கு அடிப்படையான அறத்தோடு கொடுப்பது என்பது மிக மிக முக்கியம். That is what I felt when you explained different stages of undergoing this treatment. இன்னும் ரொம்ப மகிழ்ச்சியான விஷயம், ஒரு We don't actually have any gender differences in being a male doctor or a female doctor, but this he's the first of its kind I've seen as a male consultant in this. பொதுவாக நீங்க fertility centersல the consultation எடுத்துட்டீங்கன்னா they project only women consultants. That is also a taboo. The doctor is a doctor, and it is so good to have him, a very well experienced doctor with all the expertise of wonderful team of women doctors also as a well equipped aide to him. அதுவும் ஒரு மகிழ்ச்சிகரமான விஷயம் தான். அந்த வகையிலே பார்க்கும் பொழுது இந்த சமுதாயத்திலே அது ஆணாக இருந்தாலும் சரி பெண்ணாக இருந்தாலும் சரி குழந்தை என்கின்ற அந்த ஒரு மிக மகிழ்ச்சியான தன்னுடைய செட்டிங் அப் ஃபேமிலி தன்னுடைய குடும்பத்தை ஈடுபடுத்துவதற்கான சூழல் அமையாத பொழுது மிகப்பெரிய ஒரு வரமாக இந்த விஷயம் இருக்கின்றது. அதை நல்ல முறையிலே இந்த மருத்துவமனை கொடுப்பது என்பது மகிழ்ச்சிக்கும் பாராட்டுக்கும் உரியது. Being a doctor or running a hospital, as I stated earlier, is not just for commercial costs. You must all be familiar with Che Guevara. Che Guevara, you must all be familiar maybe only as a revolutionary, rebellious leader. But he is a doctor, basically. Cuban நாட்டினுடைய விடுதலைக்கு போரிட்ட Che Guevara அடிப்படையிலே ஒரு மருத்துவர். அவருக்கு அனைத்து லத்தீன் அமெரிக்க நாடுகளுக்கும் விடுதலை வாங்கி தருவது ஒரு கனவாக இருந்தது என்றாலும் அவருடைய மனதிற்கு மிக நெருக்கமான கனவாக அவர் வைத்திருந்தது மிகுந்த ஏழ்மை நிலையிலே இருந்த லத்தீன் அமெரிக்க நாடுகளில் சுற்றி இருக்கின்ற நாடுகளில் கியூபாவை தவிர்த்து அனைத்து நாடுகளுக்கும் சென்று இலவசமாக மருத்துவ சிகிச்சை தர வேண்டும் என்பதுதான் அவர் தன் நெஞ்சிலே வைத்திருந்த கனவு. And you know how it has fruitfully materialized after Che Guevara had passed, after probably 40 years, 41st or 42nd year, when the country was celebrating his 44th anniversary, I guess. It is a usual practice that Cuban doctors would go and visit to their neighboring Latin American countries and then conduct eye camps or the regular camps providing the medical facilities. After one such camp conducted by the Cuban doctors to the neighboring countries, they received a letter from that country. And this has actually happened on the eve of the 44th death anniversary of Che Guevara. And this letter has been published by the official newsletter of the Cuban government by their grandma. What did the letter say? The letter was written by a young man who has shared his happiness. See, after the visit of the Cuban doctors, my grandfather, having had the opportunity of undergoing a cataract surgery offered by the Cuban doctors, now my grandfather is able to enjoy the sunrise, enjoy the sunset, able to enjoy his grandchildren playing football, the sea waves, like rising up, and all the fragrance and the colors of this life. And I should thank the Cuban doctors for that. And the name of my grandfather is Maria Deron. And Maria Deron was that one soldier who shot Che Guevara, who killed Che Guevara. Che Guevaraவை கொன்றவர் என்னுடைய தாத்தா. அந்த தாத்தாவினுடைய பேரனாகிய நான் Che Guevara காணப்பட்ட கனவில் பயன் பெற்று இந்த கடிதத்தை எழுதுகின்றேன் என்று எழுதியிருந்தார். That was officially published. இதை பிரசுரிச்சுட்டு அந்த நாளிதழ் கீழே போட்டுள்ள விஷயம் என்னன்னா, ஒரு காலம் தோற்கடிக்கப்பட முடியாத ஒரு யுத்தத்தில் ஒரு மருத்துவராக புரட்சியாளராக Che Guevara தன்னுடைய கனவிலே வெற்றி கண்டார். That's why you doctors are always very considered as sacred ones. Nobody can measure the service rendered by you in just rupees. That's just for your practical handling of your life. Doctors and teachers never retire in their life, and your service can never be measured with just the currency. You always have your dreams of. When a couple approaches you with this dream of having a children, you personalize it internally, taking it forward, you partake in their dreams, and then just give it back to them with all the scientific, like I would say with all the scientific, decoration is not the word, as wrapped in as a scientific gift. So that way, congratulations to each and every doctor or the team who's involved in this wonderful hospital. And again, I place it on my record, the leaps and bounds with which Kauvery Hospital is growing. Happy to be a part of it. Thank you very much.
We are considering our chief guest, you very much. Thank you very much.
As you know, today is a big day for us. We are inaugurating first IVF unit in Chennai, so which is inaugurated by our Honorable MP Madam. So thank you, ma'am. Thank you for coming, for gracing this event. So I'm extremely happy to be a part of it. Sir, so the Murray Fertility Center, like it's a state-of-art IVF laboratory. We could perform basic ART treatment and the latest advanced technology techniques perform one of the center of excellence in near future under the guidance of Chairman Sir and Dr. Gopinath Sir. Thank you for this opportunity. Thank you.
Kauvery group of hospitals is spread all over Tamil Nadu and also in Bangalore. So they have just started a concept called Ma Kauvery, where exclusively for women and children. In that exclusive women and children, this is the first IVF center is being inaugurated. So today we had the formal inauguration ceremony where Mrs. Tamadichi Tangapandian, South Madras MP came. She went to the floor, she cut the ribbon, then inaugurated the center, had an inspection about the center, then came down, and then we had a formal inaugural ceremony. There the chairman spoke, and then I just gave an update about the fertility management, and then Dr. Ramya mentioned about what the facilities we had, and then the program concluded. இப்போ இன்ஃபர்டிலிட்டி குழந்தையின்மைன்றதுக்கு வைத்தியம் நிறைய ஹாஸ்பிட்டல் இருக்குது. இது இப்போ நம்ம மெட்ராஸ்லேருந்து பார்த்தீங்கன்னா சென்னையில் மொத்தம் 65 யூனிட்டுக்கு மேலே இருக்குது. இதில் இங்கே எக்ஸ்க்ளூசிவாக என்ன பண்ணுறோம் அப்படின்னு கேட்டிங்கன்னா, பேஷண்ட் வந்த உடனே முதல்ல அவங்களுக்கு ஒரு கலந்தாய்வு செய்து அவங்களுக்கு என்ன தேவை, எது மாதிரி ட்ரீட்மெண்ட் தேவைன்றது கண்டுபிடிச்சு அதுக்கு அவங்க கூட டிஸ்கஸ் பண்ணி அதுக்கப்புறமா அவங்களுக்கு வேண்டிய கரெக்டாக என்ன தேவையோ அந்த மாதிரி ட்ரீட்மெண்ட் மட்டும்தான் கொடுக்கலாம். இப்போ நார்மலாக நான் சொன்ன மாதிரி ஒரு ஓவுலேஷனுக்கு ஒரு மருந்து மட்டும் கொடுக்கலாம். மருந்து கொடுத்து அவங்கள சேர்ந்துருக்க சொல்லலாம். அதுக்கப்புறம் இந்த IUI மெத்தட் பண்ணலாம். அதுக்கப்புறம் IVF பண்ணலாம். இந்த எம்ப்ரியோலேருந்து பயாப்சி பண்ணி செலக்ட் பண்ணி பெஸ்ட்டாக பண்ணலாம். எல்லா ஸ்பெக்ட்ரம் ட்ரீட்மெண்ட்டும் இந்த ஹாஸ்பிட்டலில் அவைலபிள் இருக்குது. அது ஒரு யூனிக் ஃபீச்சர். இன்னொன்று பார்த்தீங்கன்னா அதில் எல்லாமே வெல் ட்ரெயின்டு பீப்புள், எல்லாமே குவாலிஃபைடு சர்டிஃபைடு பீப்புள் டு டூ திஸ் ஒர்க் ஆர் டூயிங் த ஒர்க். இவங்க எல்லாமே 24 hours இங்கேருந்து பார்க்குறவங்க இந்த ஹாஸ்பிட்டல் கூடவே அட்டாச் ஆனவங்க. அதனால் இது ஒரு தனித்துவம் முடிஞ்சது. ஃபர்ஸ்ட் ஆஃப் இட்ஸ் கைண்ட் இன் காவேரி ஹாஸ்பிட்டல் குரூப்லேயே இதுதான் முதல் IVF சென்டர். ஸோ ரம்யா மஸ்ட் பி வெரி ப்ரவுட் டு பி அசோசியேட்டட் வித் தட். இப்போ கருத்தரிக்கிறதுக்கு நிலையம்னு வச்சிங்கன்னா அதுக்கு கரெக்டாக 1 கோடி வருது. அந்த 1 கோடிக்கு இருக்கிறதுக்கு முதல்ல இனிஷியல் எஸ்டாப்ளிஷ்மெண்ட் காஸ்ட் குறைஞ்சது 1 கோடி வருது. பட் அது மாதிரி நீங்கள் செலவு பண்ணிட்டு இருந்தோம்னா அதோட இன்ட்ரெஸ்ட் நீங்கள் பார்த்தாலே கொஞ்சம் குறைச்சலாக தான் இருக்கும். அதனால இனிஷியலாக இங்கே என்ன பிளான் பண்ணியிருக்காங்க அப்படின்னா கரெக்டாக காஸ்ட் போட்டு அந்த காஸ்ட்லேருந்து ஒர்க் அவுட் பண்ணிட்டு மற்ற சென்டர்லாம் மாதிரி எது பேஷண்ட்டுக்கு ரொம்ப ஹை பெனிஃபிஷியலாக இருக்குமோ அந்த மாதிரி காஸ்ட்டு. ஆக்சுவல் காஸ்ட்டு அதெல்லாம் ஒர்க்கிங்லாம் இன்னும் பண்ணலை. பட் அது பண்ணுறச்சே எப்போவுமே கண்டிப்பாக காம்படிட்டிவாக இருக்கும். மற்ற சென்டர் மாதிரி இல்லாமல் ரொம்ப ஒரு எல்லாம் ஹெல்ப் பண்ணுற மாதிரி ஒரு டிஃப்ரெண்ட் மெத்தட்ஸ் ஆஃப் ட்ரீட்மெண்ட்டு இங்கே கொடுக்கறதுக்கு வாய்ப்புகள் இருக்கு. எல்லா ஹாஸ்பிட்டலையும் வருது. இப்போ சென்னை கோடம்பாக்கம்ல இன்னொரு 15 நாளில் அது இனாகிரேட் ஆக போகுது. வடபழனி காவேரியில். திருச்சியில் இன்னொரு 2 மாதத்தில் திருச்சியில் இனாகிரேட் ஆக போகுது. ஓசூரில் ஸ்டார்ட் பண்ண போகிறாங்க. பெங்களூரில் ஸ்டார்ட் பண்ண போகிறாங்க. இது எல்லாத்துக்கும் நான் ஐ வில் பி அ குரூப் டைரக்டர், டைரக்ட் தெம் இன் த ரைட் வே, இன் த ரைட் டைரக்ஷன். இது வந்து
Radial Road.
பள்ளிக்கரணை ரேடியல் ரோட் காவேரி ஹாஸ்பிட்டல்.